So there are some pretty well-defined terms now in terms of treatment-resistant depression. First, the notion that the patient has had at least one adequate trial of an antidepressant. Most data would suggest that if we're really talking about remission, which is getting a patient back to where they were before they were depressed, that about 35% of patients treated with any antidepressant will have a great response, will be in remission within about 8 weeks. That means 65% of patients are either some better or not better at all. Treatment-resistant depression is generally defined as having failed 2 antidepressants of an adequate trial for an adequate duration at an adequate dose. There's no treatment that has ever been shown to be more effective than any other treatment. That doesn't mean that a patient might respond to one treatment and not another, but if you do a head-to-head comparison, they're all about effective, equally effective, except for ECT, which is probably the most effective, but it's got a lot of side effects and is difficult. Fact is that there is no reliable predictor, either genetic marker or brain imaging predictor or constellation of symptoms. The only predictor that may be effective is in 2 subtypes of depression: atypical depression, in which patients oversleep and overeat and have a lot of anxiety. Those patients may respond best to monoamine oxidase inhibitors, which are very old antidepressants, and psychotically depressed patients, those with delusions, must have a combination of an antipsychotic drug and an antidepressant.